The show is Morning Ride. My name is Yinka Kenny. We are coming to you live from NTA2, Victoria Island, Lagos. How proud are you proud of your mouth? I'll be discussing everything about oral health this morning. In the studio with me this morning, I have Dr. Wemembu John. He is the Secretary, Nigerian Dental Association, Lagos Zone. And also with him, I have Dr. Oluwole Olusoya. He is the Chairman, Nigerian Dental Association, Lagos Zone. Good morning.
Good morning, Yinka. Control is the word.
Okay.
I mean, I'm not going to take any candy away from any child. But what we say is that there has to be controls. You don't let a child have access to sweets as they would like. They will spoil their teeth. Brush your teeth morning and night, especially at night. Last thing after all meals. Second, make sure that you use the fluoride toothpaste and a toothbrush of bristles that match your person. Okay, so hard, soft, medium.
Now you're
hard
talking.
is for smokers, medium is for you and I, and then soft are people with dental diseases. Yes, soft. They need to use soft. And then, of course, the fluoridated toothpaste endorsed by the Nigerian Dental Association. Most importantly, we say that you visit your dentist twice a year for checkup.
Are there some specific meals that we can take that can improve our oral health?
Aside the food, you find people commonly use their teeth as a bottle opener. These are very dangerous habits. You could crack the tooth right
instantly
away. Now, for some of these artisans, you find some of them using their, like the seamstresses, you find them always having pins in their mouth. I mean, it's just like a regular. You find that pin. What that does, these are all things like that destroys the supporting tissues of the teeth. Then for our mechanics and you find them using their mouth to act as sunshine for fuel. Or even the rewires and the electricians, you find them using their teeth to cut all these wires. So there are lots of negative
everyday
out there
habits.
every day that people get involved with without actually knowing the exact implication of this on the oral health. Generally, if you do the basic things of brushing when you should, knowing when to use your floss and not toothpick. Well, people use toothpick. Yes, we are not totally against the use of toothpick, but you need to know how to actually use it. But you find people just dip in the stick and try to move it from one end of the tooth to the other end.
Okay.
That's a very bad habit.
So how should we do that?
I
I realize that a lot of people do not know how to use a dental floss.
Yes.
So they are more comfortable with the toothpick.
Now, because the makers of dental floss and the dentists have looked at this and said, okay, yes, this is a problem. So dental floss comes in different brands now. You have the one that comes with the handle like a toothbrush. It just comes like a toothbrush. So that's easier for anybody to use. I mean, it's easy for people to just use, rather than the one that comes as a string that you have to be adept at it to be able to use that one of this that comes as a string. Yeah. So best way to use a toothpick is the pointed head. You just use it to tease whatever you want to tease out and not pass it through and through.
Okay.
That's passing it through and through. Aside the fact that you are destroying the support tissues, you find out that you are creating a gap. You are creating a movement there, because once you continue to do something persistently, it moves, it gives, something will give. So you keep using that toothpick there, you destroy the support tissues, you create a gap there. Now, when you take things like apple, because the acidic content, and oranges or grape, because the acidic content is high, we advise you rinse out. Yeah, because what happens is you take these things, you have it increases the acidity of the oral cavity, and what happens is it encourages the bacteria to grow and cause harm and damage, aside the fact that the acid in them could cause erosion and abrasion of the tooth substance itself.
I took note of that. Most importantly, night. Are you saying that I can do without brushing my teeth in the morning?
No, at night. When you go to rest and to sleep, we are not actively salivating. If we have not brushed at night, We still have food debris
Okay.
on and around our teeth. The product of their feeding is to produce an acid, which normally the saliva, which is alkaline in nature, would have mopped up. But because we're not actively salivating, what happens is that the activity of the oral bacteria is more at that period, and we come down with what is called dental caries, the holes, the cavities we have in teeth, which go from holes to pain, and finally you end up in the dental clinic and you have to have your tooth pulled if care is not taken.
So you Google some things at times and you see it on the internet that when you brush, you do not rinse off. How true is that?
So we don't say don't rinse off. What we say is rinse lightly. So toothpaste has fluoride in it. The fluoride is supposed to make the teeth strong and protect the teeth from dental diseases. If you rinse off everything, where's the fluoride that's going to help the tooth remain strong?
Oh.
So light rinsing will keep at least a bit of the fluoride.
So you don't do the Googling?
No. It's not a battle. It's just a light rinse so
Okay.
that a little bit of the fluoride still remains in place, and so it will keep the teeth strong and healthy. A lot of people still chew the stick. The chewing stick has a lot of probably ingredients in it that are very good for most of those things have not been tested. Yes. And anything that is not tested, you do not know the side effects.
Well, I want to talk about bad breath. Actually, there are some people, I have come across some people that have dealt with, I've been trying to deal with bad breath over and over and over and over again, and it seems as if there is no solution. What can you say about this?
Bad breath can be physiological, which most of us, as in when we say physiological, bad breath can be something that it's normal in everybody. You wake up in the morning, you find out that you have some form of bad breath because over the night you were not actively using your mouth. Maybe for those that fast for a long time, those that fast from food and drink, you fast for a long time, you find out that when you speak, you tend to have bad breath because the same reason as when you sleep. With that, all you need to do is you rinse out, you brush out, it's gone. Now, bad breath could also be symptomatic of an underlying problem. You find those that have diabetes, when they speak at times, you find what we call ketone breath, like sugar breath from them. You find that ketone, you find a particular kind of breath. You find those that have liver and kidney diseases, when they speak, you can perceive some form of breath from them. Now, then you have the bad breath that is caused by oral diseases, like caries. You have a hole in the tooth that is decayed. You have bacteria constantly acting on it and bringing out this odor that you call bad. For the ones that are caused by a hole in the teeth or even destruction of the support structures of the teeth, which you also find in some diabetics, and that is easy. You get to a dental surgeon, you get to a dentist, he's able to look at it, treat the ones he could treat, and then refer you to the physician if need be. Now, also, bad breath could be caused as a result of accumulation of bacteria, what we call bacterial plaque. You find those stony
Bacteria in the mouth?
Yes. Those bacteria in the mouth can coalesce together and form stony structures that you find attached to the roots of the teeth, that most times at times you flake off, it comes out like, oh, this is a hard structure. Those are actually bacteria that we say have calcified. Now, when you have lots of it in the mouth, it causes bad breath. So the issue of bad breath is a wide area. It depends on what is causing it. It depends on the cause for you to know the perfect solution to administer.
There are two instances which are very common. The first one is the common cold that we have. If you've ever been around people who have common cold, just the cold, they have a bit of breath from their mouth if you smell around them. And so we find out that respiratory conditions, diseases of the upper and lower respiratory system, we're able to, identify through the breath. people who have things like tuberculosis, bronchitis,
even
from their
sinusitis.
sinusitis, from their breath. You're able to, yes, all those are infections. And then there's the last one, which is very important when it comes to bad breath, halitosis as we call it. It's called psychogenic halitosis, where you feel you have bad breath because yesterday you spoke to her and she turned away from you. You don't actually have it, but you feel you have it because of people's reaction to you.
I will leave you with the words of Robert Kennedy. He said, only those who dare to fail greatly can achieve greatly. So do not be afraid to fall, because in falling you will rise, and when you rise you become a better person. My name is Yinka Kenny, and that's where I call it a wrap on the show today. Till I come your way, same time, same station next week. Bye-bye.
Yeah, I've been away.